All right. Yes, good afternoon, everyone. Namaste. Thank you for making time to be here. It is such a joy to see all of you. I am Chetanachar. I'm an associate professor in the Department of Marketing. I study healthcare. My research specifically focuses around stigma, accessibility, health equity, and that sort of topic. So I'm so excited to be here. I'm so excited to have both Prashant and Pratap join us. Thank you. I guess we will start off this conversation with the topic that's on top of everybody's agenda and on top of everybody's minds, artificial intelligence. Okay. I will first call on maybe Prashant to talk about how AI is shaping healthcare in India and what things look like on the field.
Sure. Thank you for having me here. It's a pleasure to be here. AI has made healthcare super interesting, I think. And while it's still early, the promise is actually very real. What we found, being in digital healthcare, we actually get a lot of data. So we literally have around 120 terabytes of data of millions of healthcare consumers to play with. And suddenly this technology showed up that we found so much more can be done with this information, context, and data. And I'll tell you across 3-4 dimensions where work is happening, fairly interesting work. Number one is just, and some of it is pretty basic stuff, but transformative stuff for healthcare. Because what is it leading towards? Where are we headed is creating a personalized, predictive, preventive model of healthcare and doing it at a scale where these large data sets are informing pretty much as a user, your app, your 1mg app tomorrow should show you what you need to do today to stay healthy, so that the definition of healthcare for practical purposes is today mostly when the health has broken down, how do you take care of it? That has to move to wellness and staying healthy. And that is where all this data science and all the fun stuff happens. So simple stuff, disease progression models. You see healthcare progression of, say, a couple of million diabetes users, and you start seeing inflection points up, down. What is the right intervention at which inflection point? Right now, we've developed a tool which essentially digitizes the handwritten prescriptions of doctors. So, and that's very material, because that's where the fuel of this entire digitization of healthcare and AI comes from. First, you need to get that data. And that data, at least in the Indian context, is largely scribbles on pieces of paper. Mm-hmm. How does that get translated into usable data? So now, working along with the team, AI team at IIT Delhi, we are solving that problem, that how can that be made, because it's not OCR. Doctors' handwritings are drawings. So it's, and every doctor would have a different drawing for different medicines. So but there are patterns. They are predictable, logical patterns. And you start figuring those out, and now the models are, we made our own machine learning models 5-6 years back. All of that is now, I would say, seeing turbocharging. So suddenly a lot of things that looked very futuristic are now here and now. And so what is AI doing for us is, one, bringing a lot more raw material into the fold, making processing of that raw material to create those models of personalization. All that good stuff is happening in parallel. And I think being in India, you have pretty much all the ingredients there. There's no dearth of data. There's too many people. So lots and lots of data is coming at us every single day. There's enough talent to play with that data. There's enough opportunity to build these models. And I think the technology, firepower, or infrastructure required, thankfully, we are in a good situation to make sense of it. So I think all the ingredients are there. And next year or two, we'll see material difference there.
Okay, excellent. And speaking of futuristic, Pratap, you were working on AI way before, decades before it was a thing. So talk to us a little bit about what you see ahead in terms of artificial intelligence and healthcare in India.
Yeah. No, I think Prashant already talked about some of the really cool things happening on the ground. I think one of the things that I worry about sometimes is what is happening in the rest of the world. So you take the right lessons to places like India, right? Because as Smritiji said, every country has a different life cycle stage. And in that context, I think to me, one of the things that we're beginning to see, of course, when I was graduating from AI, this is back in 1993, okay, no jobs available. It was the second winter of AI, so I timed it completely wrong, but that's okay. I'm enjoying it now. What has happened now, though, is the big craze in the last 2-3 years was Gen AI. And so I think in terms of futuristic things, I think we have to go back to a confluence of the two types of AI and how to combine them. Because we were in this predictive AI, which is lots of structured data, predict a number, right? Predictive diagnosis, predict exactly what's going to happen. When are you going to get that heart attack? What is the probability in the next 4 months you'll get a stroke? That sort of stuff. Gen AI can't quite do that. Gen AI does something else extremely well, which is unstructured data. Now, unfortunately, the dirty little secret of healthcare is there's lots of data, 80% of it is unstructured. Only 20% is structured. But to actually get to things like diagnosis and prediction for individual cases with good confidence, you need the structured data with some appropriate mix of this as well. So what I think is going to happen in the future for the next maybe 3 to 5 years out is people are using Gen AI to save money. Essentially, it's productivity efficiency, largely. But eventually, you'll have to use both predictive AI and generative AI so that you can leverage structured and unstructured data to do the kinds of things which involve you are going to have quote-unquote event, the diagnosis probability is this much. Oh, by the way, I need to convey this message to you in a way that you can understand and you can query, and to Prashant's point, change behavior so that you can avoid that or reduce the probability. You are going to need a mix of both kinds of AI. And I think that's, to me, the true sort of nirvana, because then you're getting to effectiveness, not just efficiency. And we're seeing this across all the sectors of healthcare, whether it's pharma, healthcare delivery with providers, payers, obviously, a lot of stuff going on there as well with both, because you have to predict the risk, and people are a little suspicious of Gen AI because of hallucinations and such. And so I think getting to a point where crisp prediction is possible and believable and analyzable is going to be very important, in addition to the way you interact with a human being, where Gen AI comes into its own.
All right. Thank you. I appreciate it. So I'd like to pick up on this thread of thought about suspicion, suspicious about data and suspicious about AI. And let's open it up into a broader discussion on trusting science, data, privacy, and so on. So how do you see those challenges coming up, Prashant? What are your thoughts on data privacy, trust in data structures?
I think privacy is table stakes, and systems are now fairly well evolved to design for privacy. You have to take care of the basic fundamentals as these systems. And in fact, I think on that point, almost all the learnings are available. We just need to make sure that they get incorporated in the models that we deploy. So with that as the fundamental foundation of it, a lot of this, so how do you process data, etc.? How do you make sure that it's algorithmic and not kind of using the specific patient identifiable data kind of stuff? Those things are fairly straightforward and easy if the intent is there. And regulations are catching up, and they will. So I think the main interesting point about this entire data stream is that the unstructured data coming from so many different sources is now it is possible to make sense of it collectively. And I think that's where earlier the data set also used to just flow in from EMR, EHR, or those systems. Now your variables are giving you real-time data. Your browsing behavior is giving real-time data. You're just getting so many more indicators in this entire pool. So the variables that you get to play with are becoming interesting. And as solutions will come, there's still work in progress. But I think that is, we have got a lot more material to play with in this. For a commercial enterprise, making sure that you take care of privacy and all is actually it's imperative for your business. You won't exist if you put those kind of things at risk. So, I don't see that as a technical concern. It's an intent question, yes, but if your intent is to be in the game of trust that is healthcare, then you better set those up.
Sure. So but let's look at it from the perspective of patients and healthcare providers. What are perceptions of healthcare providers and patients on the ground? Do you think there is both trust in the science of it and then trust in the tech firms that are
I think there is this anxiety around the one, of course, the hallucinations part of what these models are going to throw up, and is it okay to be correct 99% of the times and 1%? Is that acceptable, not acceptable in a situation like healthcare? So those questions are there. However, I think those are natural questions, and it's the players have to, over a period of time, earn the trust of the consumer. Because see, strictly, if you look at it from a data perspective, it's not like the current healthcare ecosystem is delivering the gold standard every single point in time. So it also operates with its own degree of deviations. The consumer today, when they interact with a digital system, their fears are more highlighted for some reason. It is true. We have to build their confidence that the systems, and see, the transition is not a 0 to 1 kind of transition. In fact, it starts like this, that it's human only, then it is human assisted with technology, then it moves to technology assisted by human, and then finally, if at all, you reach a stage where technology is kind of managing it by itself. This journey has enough time horizon for trust and comfort building to happen. 0 to 1 switch, I don't think is either expected or advisable in these kind of situations, because you have to build that confidence of the consumer.
Yeah.
If I can add to that,
Yes,
I think one of the interesting things is, and this is the shocking part, people will say to me, oh, but the AI will give you wrong diagnosis. What if that happens? Humans are doing diagnoses today, and I know there are some physicians in the audience, but it turns out that 15% of diagnoses done by human physicians today are wrong. 15%. That's the biggest number, okay?
Yeah.
If an AI did 15% error, you'd be up in arms. If the AI does 10%, to Prashant's point, well, that's better, but people are still not happy. So there is a little bit of this referencing going on. So I think we have to keep that in mind. I think the other thing I want to address in terms of trust is this broader issue of physician trust of AI. Now, on the consumer side, it turns out actually India is ahead. So in India, we do a Future of Health survey every couple of years of consumers from different countries and physicians. And it turns out in India, 46% or some number like that of consumers are very open to digital, right? Because of course, everything that's happened in fintech and all that. So the acceptability is pretty good. And in fact, from the consumer side, if you say, well, are you willing to let AI participate in the process? 65% will say yes. Now, that's actually better than what you have in the US even.
In the US.
Okay, so from a consumer perspective, I think things are actually at a better place in India and improving. Physicians is a very interesting dynamic. In the US, physicians actually don't trust AI. They are okay with AI doing the background stuff, like write my notes for me. They're not okay with AI saying, oh, I'm a peer, I'm going to help you do the diagnosis. And in fact, there's an old quote, I'm sure you've heard it, because I get asked, will AI replace physicians? And the quote is, AI will not replace physicians, but physicians with AI will replace physicians without AI. So, of course, nirvana, like you said, Prashant, human and technology working together. Turns out, when you do the actual experiment, that doesn't work. AI alone trumps physicians with AI. And you know why that is? Because the physicians are given the AI input, they don't trust it, they throw it away. So this trust issue, we have to solve, whether it's in the US or in India. Now, India, the good thing is, many of the healthcare encounters that we want to have happen won't happen because I don't have a physician. I don't have a healthcare worker because the gap is huge in terms of the physicians and nurses. I think it's a million people. And so that's the gap. And so people are saying, you know what? Fine. AI is better than nothing. But here the problem is I have something and I have to undo it to trust AI, and they have to undo it and trust AI, and that's not happening. So in my sort of comparison of these two worlds, I think India is in a much better position because it's starting from a position of scratch in some sense. And we have the opportunity to build up better and differently, learning the lessons that we have from the rest of the Western world.
Yeah, that's absolutely correct. I think, see, the thing is, because when you look at the Indian healthcare system and the doctor to patient ratio, so and so is the WHO recommended, or US doctor to patient, Europe doctor to patient, India is way behind. India will never have that kind of number of doctors. It takes 5-7 years to prepare a doctor, and we don't have, we have probably 1 million doctors and we need 3 million. So getting 2 million doctors in the ecosystem probably is not going to anyway happen. But with something like AI, the productivity of this 1 million doctors to grow 3x or more is actually a much more realistic and a much needed kind of an opportunity, because that is where on the quality continuum also you see improvement, and on the access and cost and affordability, everything kind of takes care of itself. So yes, the starting point does make a difference. In the Indian situation, it's a pretty much more, I would say, it's a massive productivity jump that fundamentally changes the equation of healthcare, that what is the right doctor to patient ratio. So when you say what is the right doctor to patient ratio when they are enabled with AI, that ratio is materially different. And that's what the country needs, actually.
It sounds to me then, going back to the topic of the session, it sounds to me that you are optimistic about AI adoption by healthcare providers just because the scale is in favor of adoption. It's just the fixing that gap between the ratio of providers and patients.
And see, for any physician, of course, there will be a learning curve, there will be some resistance, there will be some mistakes. It's not, as I said, it's not an overnight switch perhaps, but at least right now, it is that the physician has an intern working with him that has all the knowledge of the world available and is able to present that, okay, maybe in this situation, this is what is the right thing to do. Have a look. And if you do it with an open mind, you'll find more often than not that entire knowledge of the world that is accessible to this assistant that you have will help you get better and diagnose faster. So I would say the direction is fairly clear, but some people will jump on right away, some will take their time, but it is going to happen. And it might well happen faster in countries like India and the global south than in the Western world.
Yeah. No, because you have to undo so much. And I think that's a good position to be in, where you don't have to undo a lot of legacy thinking, legacy infrastructure.
Mm-hmm. Yeah. All right. Speaking of challenges that seem to turn into opportunities, I'd like to talk about patient access, patient affordability,
sure,
and gap in healthcare provision, which historically has been very large and concerning in India. And I want to hear from both of you on what your outlook is, both challenges, optimism you see in how technologies are working in favor of helping healthcare access and accessibility in India.
Sure, I can get started. I think one of the things that we saw, so one of the things that ZS does is we sponsor this thing called the ZS Prize. It's in healthcare in India. and we work with startups because I think we are mostly focused not just on the technological coolness factor, but access, which is, can you come up with, as other people said, jugaad, but this idea of frugal innovation is really important, right? Because we're not trying to do cutting edge stuff like you might do in the US. In India, it's about frugal innovation to create affordable access, exactly the phrase that you used. So, we have the ZS prize. So we start with about 25,000 people register. In the end, there are 20 startups. And there's the whole process. And a few startups get a few crores of prize money. But I think the observation was that the ones that succeed, that are really impressive, are things that are not about AI. Okay, that is a relatively recent trend. But there's a lot of good creative ideas about creating simple digital platforms that make things accessible through your mobile phone to many, many hundreds of millions of people, conceptually. And that's a big deal, right? If you sort of think about India, sort of these innovating startups, lots of them, then there's about 35% of the population that I would call sort of urban, middle class plus. And then there's 65% that's rural, underserved, beyond the tier 1 to 3 cities. So you've got to think of this in the waves, because what has happened now is innovation is very robust. That's been really encouraging to see. No dearth of innovation. Now it's all about scaling. So how do you scale through that first piece? That I think is beginning to happen. Pretty good access, reasonable affordability. The problem will be affordability with that last step. Now, of course, you again heard, I think, the central budget increased, the funding for Ayushman Bharat and other schemes like that by about 10%. So now the idea is to get about 50% roughly. All the people above 60 or 70, I think the threshold is now getting more liberal over time. So I think that will help government funding do affordability there. Private equity has gone up by about 200% just in the first 6 months of last year, I think the latest number I have. So the money is coming in. So it's less about resources, but it's about making sure that we can get affordable access in terms of something cheap that's scaling. And of course, 1mg is a great example of that. But there are many, many other such ideas as well. So there also I'm very optimistic about it. The catch, of course, is you have to make sure that people are actually be able to access it. That has become one of the problems in the US. You don't think about it, but it turns out that when we do digital health here, inner cities, rural America, they don't get access easily. And I think India is doing a good bit to leapfrog that. I think the CG spoke this morning, 900 million people can now access the internet through mobile phones. So we're getting to the point where we might still leave the last 500 million, but you can begin to see how we're moving through these 3 steps. And I think it's very encouraging.
Yeah, no, I think mostly well covered in the comments, but I'll just add a little more context. From the 1mg experience. On our platform, annually we have around 250 million unique people come and access the platform largely to read healthcare content, and then a bunch of them transact getting their medicines, lab tests, consultations or whatnot. So it clearly shows that the consumer participation in healthcare, and that Indian context also helps in the sense that the payer is the customer or the patient. So the alignment of interest, at least of 2 of the 3 components of the chain, is fairly clear. So the consumers are getting much more involved in learning about their healthcare. That's the starting point. And that's a material shift, because healthcare has been one of those spaces where consumer participation has been actually very low. Most consumers kind of shut their mind when it comes to healthcare, that it's too complicated, but now they want to engage. They want to understand what's happening, why, and what's the right thing. So that's where it starts. Now, once the consumers start expecting or seeking solutions, entrepreneurs figure out best ways to serve these consumers, and we are seeing that bubble across the ecosystem. Now, what did we do? First phase was just putting in the plumbing. Get your medicines across to you, your lab tests, consultations, and where the physical infrastructure would not reach. An Indian context again, we've got like around 1 million pharmacies, of which the entire organized ecosystem is 15,000 pharmacies. Rest is all mom and pop. Similarly, more than 100,000 diagnostic labs, around 15,000 again in the organized sector. Everything else is mom and pop. So organized infrastructure for delivery of healthcare has not really reached most parts of India, but the digital infrastructure reached much more easily and effectively. So today, as 1mg, we deliver medicines to around 2,000 cities in India. So and from absolutely nothing, starting around 10 years ago, we are in healthcare services, a top 10 healthcare companies of India, and we are only largely digital. All the other nine others are brick and mortar companies that have been around 25, 30, 50 years. So the digital footprint, and we are riding on the wave created by this entire digital infrastructure that got built over the last couple of decades in India, whether it's the payment infrastructure, the logistics infrastructure, all these, the consumers are very attuned to, they are very sophisticated users of technology in India already. And again, the lack of legacy actually makes the transformation happen a little faster. So we are benefiting from that. And the next part is the macro on what is the government doing in healthcare. So the fundamental shifts, two shifts. One, the government used to be a parallel provider of healthcare. From there, they have shifted their view to be a payer of healthcare and an enabler of healthcare. So, and these shifts are very profound shifts, because now the private sector can also participate in the public paid healthcare. Yes. So all these things are happening, and now with UHI coming, Ayushman Bharat, of course, is there as a payment solution. UHI is the interoperability solution. As these things happen, the entrepreneurial ecosystem just needs to ride on these and build more patient-centric solutions, and we'll keep seeing that. So it's an exciting time right now.
That's an important point. I think in the US, 100 years ago, 1,000 flowers bloomed, we let it, and now it is not something we can change easily. I think India has an amazing opportunity to start from scratch. So you let the 1,000 flowers bloom in a planned garden. And that is a big role for the government, because if the government can come in early, set policy, set standards. I mean, having a universal patient ID is still not a possible law in the United States. That's crucial. You have interoperability, you have a common standard. Here people are still struggling to figure out HL7. But India has an opportunity, and that is the role I think the government needs to play, as to what is the ecosystem plan, so that all these entrepreneurs, whether it's health tech, whether it's insurance companies, private hospitals, Adani, Bajaj, Apollo, everybody building, how do they plug in? What is the ecosystem with standards, with protocols, with the appropriate guardrails, so that people have the certainty and the confidence that they're not entering a huge mess, that there is a way to navigate this, and it's sort of streamlined. I think that's really important. That's a huge opportunity. It's beginning to happen, but I think it needs to happen faster.
Okay, thank you. On those very insightful and forward-looking words, I think we're at time to open up questions from the audience. We'd love to hear thoughts, please. We have volunteers. Raise your hands. Thank you.
Thank you so much. So we've learned a lot about healthcare payers and services from you guys today, and have had the opportunity to learn about tech and AI today a lot. Could you speak a little bit more to innovation in the biotech, biopharma, and medtech space happening in India? Because I feel like, you don't get to hear a lot about it. I know it's happening to a certain extent, but where's the pace at for that, and regulations especially in terms of biotech and biopharma growth?
Yeah, I can definitely start there, because ES ends up working a lot in life sciences. I think when I talk to the multinational life sciences, their interest in India is low. I was just talking to someone yesterday who said it is really hard to figure out how we would get paid for innovation, right? Which is branded pharma's issue. Now, the innovation that is happening, by the way, is obviously on the generic side, which is as these drugs move out of patent, or we have an alternate formulation. I think, so I'll give you an example, right? So Gardasil, which is Merck's HPV compound, is available in India, deeply discounted from the US prices, but it's still 10,000 rupees per dose. Now, what the Serum Institute produced with Servavac is about 1,500 rupees a dose. So that the innovation is about taking something that's sort of reasonably well understood and figuring out how to do it significantly cheaply, as opposed to inventing the world's first HPV vaccine. So the nature of innovation is different in the biopharma space. Same thing is happening in medtech. Medtech, there's a story, many of you may have read it in some of the books that came out, that GE had a machine, an MRI type of machine. It's $1 million or $2 million in the US. Nobody's going to buy that in India. So how can I take $1 million machine and make a $50,000 version of it, which can be carried in a backpack, disassembled, can work without power with minimal training, right? So you have to redefine the problem, and frugal innovation absolutely works. So to me, that's the kind of innovation that's happening much more and needs to happen that way, rather than what I would call sort of traditional cutting edge in terms of discovering the next frontier of biology.
Wonderful. Next question.
I had a quick question. Here. On the front here.
Okay.
Okay. So I want to talk about two major points, especially given the Indian market. In India, there's usually a mindset saying, "Yaar, ye to kuch nahi hai, PCM kha ke so ja." ठीक है. So how is AI going to complement that mindset? And two, when we talk about AI in healthcare specifically, what level of penetration are we talking about? Is it AI complementing the doctors in analyzing data, or are we talking about complete taking over?
I think it's one, AI, and I think as Pratap also mentioned, one, the efficiency play is very straightforward and will happen. I think the AI assisting with a lot of what otherwise would be rudimentary data collection and all that stuff, all that stuff is going to anyway happen. The journey to AI being your health partner and a digital doctor, I think at least the first few phases in my view are AI being the assistant to the doctor, the physicians getting comfort with it, physicians actually becoming more productive with it, and then figuring out that, okay, the customer segments will get created. There would be a certain set of customers that would be just served by AI. Certain level of sophistication would require additional human intervention, and so that's how at least I see it evolve. So a little bit of everything is happening as we speak, and the first phase is, yes, productivity improvements, efficiency. That's almost a done deal. Now, one example, just digitization of health records and all that. So there are a lot of those tools. In fact, when I went back to the US, the first tool, we also went with the e-prescription module and things like that. Things that genuinely slow down the doctors, and but that's how you used to get the data. Now it's you just scribble as you do and click a picture and leave the rest to technology to make sense of it. And so the doctor's ability to then participate in the digital revolution without really changing behavior and get the benefit of that productivity and quality gain, and having that input, at least whether they want to take it or not, becomes real. And this is not a futuristic thing anymore. This is like happening as we speak. So I think it's very soon we'll see at least a lot of AI should get into the curriculum of healthcare. I think that's what's the important thing. And that's material also, which is, especially in India, in class 10th, you decide medical or engineering, and then those two never meet. They keep going divergent. And I think the integration of technology and data science with medical, in fact, that's one of the few secret sauce of, I would say, points of what makes 1mg's work, is that we could get all these different streams to come together and work together. Now it is becoming imperative for these two to converge a lot more. So and again, I think the doctors of the future have to be ready to work with the technology that will be in play. So the actual reform needs to come that side, education.
That's a very powerful take, that public education reform as a part of healthcare and tech reform. That's something to brew on. Thank you.
One other thing I want to add. We've talked so much about AI and technology. I want to be, as the AI PhD guy, I have to say, actually we need to put that to one side and also worry about the human side. One of the things that struck me very strongly, especially in countries like India, it's also an issue here, but India, Rwanda, Africa, many developing countries, is the last mile. So AI, data, they'll all come to the insight, the decision, but the action. Who's actually palpating your liver? Who's giving you the injection? Who's convincing you to participate in treatment? That is that last mile community health worker and equivalent, right? These people are not the doctors. We can't afford that many. But there is a place for that health worker, the human, who will bridge the last mile for people who are not just doing preventive, who are genuinely sick. And I think that is a huge issue. We need more of them. They're voluntary. They get paid very little, if anything at all. One of the projects we are doing in Gujarat is for Anemia Mukt Bharat, basically India freedom from anemia. And we work with Asha and Anganwadi workers who actually go into the rural villages, right? Because the people are not coming to healthcare, so healthcare has to go to them. That has become a change. And who is going to take the healthcare to them except for these community workers? They're sort of minimally trained, but they're convincing them. And the people are like, back to your stigma topic, they're like, no, I don't want to test for anemia. Anemia is a huge issue in India. But then the workers convince them, like, okay, not for you, but maybe for your kids. The people go, kid, I will admit in the test because I don't want anything to happen to my child. Me, I'm khake so jao, right? Like nobody is worried about that as a thing because it's pretty silent. And so then we said, all right, then our workers go to the schools because that's where the kids concentrate and they reappear. So you can do the testing and whatever else. And so as a result, it's real. Anemia rates have come down in those parts. But all the data is then getting captured digitally on iPads. So my point is the digital part is really important, but the human outreach, the convincing, getting beyond the cultural barriers, getting 1.4 billion people to do that is not trivial. And that's not going to happen just because some prompt on a screen told you to do it. There is that human element involved. So I think we have to make sure that as a government, we also invest in that because it's through the confluence of that you complete from A to Z.
And I think healthcare worker, absolutely. But even for the physician, I think when we think of comparing, we compare against the gold standard, a 20-minute consultation with all the questions asked and a full conversation. Go to an Indian hospital in OPD. They're literally 30 seconds a consultation. All those 30 seconds are data input and write a prescription, hand it over, go. There's no other time for any of the very important conversation. It would be much better if the data input and processing is supported by the system and the physicians have time to do the more important counseling, comforting, explaining, because that part is where the real value add is going to shift of healthcare, and it's immeasurably important in the healthcare journey of the patient.
Yes.
So that's what I think. That's what it enables. That's how quality also gets better. So those things, which is why I think India is a ripe market to benefit, or in fact, it's imperative for a market like India for these reasons.
Yeah, if I could, I was going to ask you, and you answered a lot of the questions already. But what you described is what I live every day. So I'm a physician, I'm an entrepreneur, I do a ton of AI. The problem with healthcare is everything is in silos. Over here, everything's electronic. We have zero paper. I don't write anything. I probably don't own a pen other than one I carry for sure. But everything is in silos, EHR, all that stuff. So spend the last decade putting it all together on a platform. And now we're at a spot. So I have a patient yesterday, comes the day before, from Israel. Speaks only Hebrew and Russian. Families over there on a platform, they connect. I get the medical records. We gave it to LLM, translated it, summarized it. The family member's sitting there. I'm communicating with the son in Israel. we decided the therapy, started the treatment here, they're leaving next week. You can't do that because AI's real thing is the cognitive revolution. I could not process 74 documents within a short time. I can't compile it. That's your efficiency. Most people are looking at AI like Harry Potter's wand, something's going to happen. It is just a powerful cognitive tool. It's getting all the data that's out there. And I see this, somebody this morning described the 8th continent, the digital continent. And my TAM has grown. We have patients from India, Israel, all of digital, Canada, they're reaching us, they're consuming our information. But I'm a healthcare provider, so there's a dimension between medtech. You'll never see a broke medtech or pharma company. You don't see a broke insurance company, and this is the U.S. health system. You'll see broke doctors, small hospitals. You go to the inner city in Chicago, it's worse than I studied in KEM in Bombay. So I think what you're doing is fascinating. I think it'll be great for the students to know what you said, 0 to 1. Because there are 3 countries in one. I call India a subcontinent, not a country. What is the difference or the impact that you're going to have at the Medantas of the world and you're going to have in the village? I think that's...
Yeah.
I'd love to hear.
Yeah, no, I think as the impact on the villages would probably be more profound and faster. And on the Medantas of the world, it would just actually be on the quality and just making sure that the best advice in the world is actually, there are no blind spots, so they would be using it as an assistant. And the third tier, it would probably be the primary delivery of healthcare that will be, so that the shift to technology-driven healthcare would probably be more in that segment, which today doesn't have access. That's the first one problem to solve. On the other side, it's the quality problem to solve. But there is, I think, work happening in both dimensions. And I think there's the movement I can see everywhere. The impact is, of course, more profound in the tier 3.
I believe we have time for just one more question.
Hi, my name is Karan Gupta. I have a question. So we talked a lot about healthcare, we talked a lot about AI, we talked a lot about like pharma, consumer, but I think we haven't touched upon like a very, very big like topic, which is mental health. So I think mental health is a very, very big opportunity, but also a need in India. So, and I've also done some research where, like, from a government standpoint, there's not a lot of funding getting given to a mental health side in India. So can you guys talk a little bit more about, like, what can we do? Like, how can we bridge that gap in India, especially there's 1.6 billion people?
So I'll just start on that. One little correction, mental health, actually the government has included, it's a mandatory coverage now. So all insurance covers in India have to cover for mental health. So that part is taken care of. Having said that, it's massively underserved. Mm-hmm. It's there are taboos, stigmas, all that stuff, and I think it's becoming a bigger and bigger problem in the world that we live in, with so much stimulus all the time, and right from early childhood, it's just a very the assault on the mind is full time and real time, and taking care of your mind as you would take care of your body is not something that is taken up as seriously as it needs to be, and going down the line it'll become more and more critical that it is addressed. I'm especially worried for the children and the teenagers these days with the kind of stimulus that is always on. Now, will there be a market opportunity? It seems natural, but like with all such opportunities, it's not like a slam dunk, because we are in an ecosystem where the number of people who seek solutions for mental health management and just making sure your mind stays strong is still, unfortunately, very, very nascent. And on our platform also, we offer that. We are bullish about the space, but it's also it's a multi-pronged situation. Starts with actually we don't have enough good counselors, and a bad counselor is worse than no counselor. So you really need that part of the supply chain to be taken care of. Then the other part is the person who's dealing with the issue should be like in the US, when I came for the first time, I was almost shocked that every second person has a counselor that or a therapist that they would be pretty open about going to, and it is like it should be like that, like going to the gym for your physical health, going to your counselor for your mental health should be why not? But that's not where the ecosystem is there today. Will that happen? It should. Has that been tried? Yes. Has it happened yet? No. But as I said, why are these hard problems to solve? Because these are multi-stakeholder marketplaces where all the things have to come together. High quality counselors, behavioral shifts, and measurable and visible ROI. And all of these is, I would say, a good space for someone looking to be an entrepreneur. But there is genuine reason why it hasn't happened. Anybody who delves deeper should figure it out. And I think I can only underline it that it's one of the biggest challenges of the coming phase, and I sincerely hope there's progress on this dimension.
All right, on that hopeful note, we are at time. Pratap and Prashant, thank you so much for your thoughts and your time. And everyone, thank you for being here. This was wonderful. Thank you.